class we are going to study about hearing evaluation in the pediatric population. When we say pediatric, the definition changes for many. We'll take it from 0 to 10 years, let us say. Fine, or 0 to 12 years we'll take the pediatric population. Done. So the most favorite test of ours is what? Pure tone audiometry. So can a child by 3 years we put on a headphone and can we ask him or her to raise the fingers whenever there is a sound which is heard, whenever there is a minimum sound which is heard? Can we do that? Will the child do? No. So that means to do pure tone audiometry in its proper format, to get the type and degree of hearing loss perfectly, the minimum age is what? 5 years. So minimum by 5 years. A mental age of 5 years is required to do pure tone audiometry appropriately. But we know hearing develops much earlier. How earlier it develops? Hearing develops how earlier? It develops in the mother's womb by 5th month of gestation. That means 5 for the 20 weeks it starts developing. You all have heard of the story of Abhimanyu, isn't it? Abhimanyu was in the mother's womb, Subhadra's womb, and Subhadra was feeling uneasy. She was in her 6th month of pregnancy and she wanted to be comforted. She was uneasy. So Arjuna did what? In a park, he narrated the story, the art of getting into a Chakravyuh and coming out of it. Correct? Right? Subhadra must be a warrior by herself. That's why she could understand and she could show interest in something like a Chakravyuh. So woman empowerment in India is a age-old thing. Correct? So she heard the story with much interest. But till Arjuna narrated going into the Chakravyuh, she was hearing it very comfortably. But when he narrated the way out of Chakravyuh, she fell. So the consciousness of the mother gone, the consciousness of the baby also gone. And that's the story. We know in Mahabharata, Arjuna could penetrate the Chakravyuh but could not come out of it. He had learned the skill in the mother's womb. So symbolically, it says what? It says that hearing is available to the child even in the mother's womb. We have multiple experiments in which we have told rhymes to babies and the babies have responded in a very positive way when they were delivered. So in the mother's womb, if you make the mother hear certain rhymes, the mother hears them, even the baby gets tuned to it, and when the baby is delivered, after that, his or her response to the rhymes will be different. Correct? That's proven. Now what happens if hearing sense develops so early, then when the child is born, the child can hear things. But the bad part of it is that the critical age or the age by which neural reorganizations happen in the auditory nerve and the child becomes adapted to certain speech stimuli to learn it is only in a very short critical age. And this critical age is very less. And this critical age ends out somewhere around 1.5 years of age. It peaks around 1.5 years of age. Then it comes going down. Which means what? If a child is not made to hear speech by 1.5 years of age, then the auditory nerve and the entire auditory system does not get tuned up in a way to process speech. Understood? Processing speech is what? If I talk to you in Tamil, let us say, many of you who are just learning Tamil cannot process Tamil in the same rate as other people do. Understood? Just hearing is not sufficient. Processing is also required. Similarly, processing speech requires certain neural reorganizations which should happen at a critical age, that peaks around 1.5 years of age. Understood? That means we need to check the hearing of every newborn baby. Only then we can ensure that the baby gets adequate amount of benefit out of hearing and can learn how to speak. Understood? So speaking is something which is very much dependent upon the hearing. That's why we need to check out the hearing, and there is a universal newborn hearing screening program. Means every baby which is born should be checked for hearing. Every baby which is born should be given polio drops, no? Universal program. Similarly, every baby which is born should be checked for the hearing. Now the question comes in when a newborn baby comes to your hand. If you say, oh, do you hear? Can you raise your hands? Will the baby do it? No, the baby will not do it. The baby will not do it voluntarily till 2 years of age, remember that. So the moment we have to check for hearing of a baby or a child, then we break it up 0 to 2 years of age, let us say. Till 2 years of age, any reliable conditioning cannot happen. So we take this entire group 0 to 2 years of age as one basket, and we start putting in some tests. Okay, which are the tests which can be done? There can be two types of tests. One is behavioral test, in which the baby need not participate actively. Other is the behavioral test, in which the baby should be participating very actively. So the non-behavioral tests can be the reflexes. I told you that if you clap, then there is a blink, there is a startle, there is an oral palpebral reflex also. So can we use these things? When the baby is sleeping or in the mother's womb, can we clap like this, or can we say, hey? Or can we whistle, or can we just bang the door and say, startle is there? No, we cannot do that, because the reliability and validity of a test should be high. These reflexes are not emerging 100% of the time. The hit rate is 50%. There is a lot of adaptation into it. So the first thing which you people should learn is, as audiologists, you should not be using reflexes as a parameter to decide whether the child is having hearing loss or not, because it has a 50% hit rate and lower hit rate. Understood first lesson? The second thing is, then what do we do? There are a set of non-behavioral tests. These non-behavioral tests are electrophysiological tests, and they are auditory brainstem response and otoacoustic emission. The auditory brainstem response picks up the response of the nerve nuclei and puts it in form of a graph. The otoacoustic emission gives a sound, takes back the response of the ear, and checks whether the outer hair cells of the cochlea are working or not. So these are indirect means to identify whether hearing loss is there or not. Indirect ways, remember. But these are the tests which are of choice. But a baby when is 3 months of old has neck control. When 6 months of old can be made to sit down, and the baby will be reaching things. So by 6 months of age till 2 years of age, there is another test of choice known as VRA, or visual reinforcement audiometry. So the baby or the child is made to do VRA to identify the presence of hearing capability or to identify hearing loss by using a visual stimuli coupled with an auditory stimuli that we will be learning. So from 6 months to 2 years, it's a very reliable test. From 2 years onward, 2 years to 5 years, we can do another test known as conditioning play audiometry, where the baby is taught to respond by putting down a ring or dropping down a peg on hearing a sound. So there will be sound ting, the baby will be taught to put down a ring. Again, to take something, then ting, put down something. So voluntarily now the baby is doing this particular response. So it is known as conditioning play audiometry. 2 years to 5 years. Beyond 5 years, pure tone audiometry. Understood? So this way, when we are going to a pediatric population, check out whether it is electrophysiological test, visual reinforcement audiometry, conditioning play audiometry, or pure tone audiometry. Electrophysiological tests are the golden parameters, specifically very important for 0 to 6 months, 100% you have to do it. Then comes in the visual reinforcement audiometry, 6 months to 2 years of age. Then comes from 2 years to 5 years, the conditioning play audiometry, and then 5 years plus is pure tone audiometry. The emittance audiometry is also used in between some time to check out reflexes. So these are the series of tests which are used to evaluate hearing in the pediatric population. Understood? This is all. Thank you.